Welcome back to Helix. I want to talk about something that affects virtually all of us, but rarely gets the attention it deserves until it becomes a crisis. Your kidneys. These two bean-shaped organs tucked away in your lower back are performing extraordinary work every single day of your life. They filter approximately 200 litres of blood daily, removing toxins and waste products while simultaneously regulating your fluid balance, maintaining precise electrolyte levels, producing essential hormones, and keeping your entire system in equilibrium. When your kidneys begin to fail, everything else starts to fall apart. The cardiovascular system struggles, your energy collapses, your bones weaken, and your quality of life deteriorates in ways that are difficult to reverse once the damage reaches a certain threshold. The reality that most people do not fully appreciate is that chronic kidney disease develops in nearly everyone as we age. This is a normal part of the aging process, but the rate of decline varies enormously from person to person, and this rate is what matters from a longevity perspective. Some people maintain excellent kidney function well into their 80s and 90s, while others experience significant decline in their 50s and 60s. The difference often comes down to early detection, lifestyle factors, and appropriate medical management. The tragedy I have witnessed repeatedly over my years in emergency medicine is watching patients arrive with advanced kidney failure that could have been prevented or significantly delayed if the warning signs had been recognized and addressed years earlier. When we review their medical histories, the clues are almost always present. The signals were there for months or years, but nobody connected the dots. Nobody recognized that the persistent fatigue, or the foamy urine, or the unexplained swelling were not just normal parts of aging or stress, but were early distress signals from kidneys that were struggling and needed attention. The first warning sign that most people overlook is foamy urine. Now, occasional foam when you urinate is perfectly normal and nothing to worry about. If you are dehydrated or urinating forcefully into the toilet, some foam is expected. But persistent foam that does not dissipate quickly, foam that looks similar to what you would see when using dish soap, this is a red flag that warrants investigation. This type of foam indicates proteinuria, which means significant amounts of protein are present in your urine. To understand why this matters, you need to understand a bit about how your kidneys filter blood. Your kidneys contain approximately 1 million filtering units called nephrons, and each nephron contains a structure called a glomerulus, which is essentially a bundle of tiny blood vessels surrounded by a sophisticated filtration membrane. This membrane is designed with remarkable precision to allow small molecules and waste products to pass through into the urine while keeping larger, more valuable molecules like proteins in your bloodstream where they belong. When your glomeruli are healthy, almost no protein makes it into your urine. The filtration barrier is simply too effective. But when these barriers become damaged, whether from diabetes, high blood pressure, chronic inflammation, or other causes, they begin to leak. Proteins, particularly one called albumin, start passing through into the urine. These proteins behave similarly to soap molecules, creating persistent foam when you urinate. What makes this particularly concerning is that the presence of protein in the urine is not just a marker of kidney damage, but actually accelerates the damage further. Proteins in the kidney tubules trigger inflammatory responses and oxidative stress, creating a vicious cycle where damage leads to protein leakage, which leads to more damage. If you notice persistent foam most times that you urinate, particularly if it is accompanied by any of the other symptoms we will discuss, you need a simple urine test. A dipstick can detect protein quickly, and if positive, a more detailed analysis can quantify exactly how much protein you are losing. Early detection and treatment of proteinuria can significantly slow the progression of kidney disease. The second warning sign is ankle swelling, something many people attribute to standing too long, hot weather, or simply getting older. While mild occasional swelling can result from these factors, persistent swelling that does not resolve with rest and leg elevation is often an early visible sign of kidney dysfunction. The mechanism here connects directly to the protein loss we just discussed. When your kidneys are damaged, they do not just lose their filtering capability, but also lose their ability to regulate fluid balance and maintain proper protein levels in your blood. As protein leaks into your urine, your blood protein levels drop, creating a condition called hypoalbuminemia. The albumin in your bloodstream serves an important function beyond just being a protein. It creates what is called oncotic pressure, which helps keep fluid inside your blood vessels where it belongs. When albumin levels fall, this pressure decreases and fluid begins leaking out of your blood vessels into the surrounding tissues. Gravity pulls this fluid downward into your lower extremities, which is why swelling typically appears first in your ankles and feet. As kidney function worsens, the swelling can progress upward to your knees, thighs, and eventually affect your hands and face. There is another mechanism contributing to this swelling as well. Damaged kidneys cannot excrete sodium efficiently, and since water follows sodium retention leads directly to water retention. This increases your total body water, contributing further to the edema. The pattern to watch for is swelling that persists despite elevating your legs, swelling that is present when you wake in the morning, and swelling that pits when you press on it, meaning it leaves a visible indentation that slowly fills back in. These characteristics suggest fluid retention that needs medical evaluation rather than simple end-of-day fatigue in your legs. The third warning sign is perhaps the easiest to dismiss because it is so common and has so many potential causes, and that is fatigue. But when fatigue is related to kidney disease, it has specific characteristics that distinguish it from ordinary tiredness, and it is driven by a specific mechanism that has been extensively studied and documented. Your kidneys do far more than filter waste products. They also produce a hormone called erythropoietin, commonly known as EPO, which signals your bone marrow to produce red blood cells. When your kidneys become damaged, EPO production declines. With less EPO circulating in your system, your bone marrow produces fewer red blood cells, and you gradually become anemic. Anemia means reduced oxygen carrying capacity in your blood, which translates to less oxygen delivery to your tissues, your muscles, and your brain. This creates a type of fatigue that is profound and persistent in ways that distinguish it from normal tiredness. It is not the tiredness you feel after a poor night of sleep that improves with coffee or a nap. It is a deep exhaustion, a heaviness in your body that makes even simple everyday tasks feel overwhelming and difficult. You might find yourself needing to rest after activities that used to be easy for you. You might experience difficulty concentrating or mental fog because your brain is not receiving optimal oxygen. You might feel short of breath with minimal physical exertion as your body tries to compensate for the reduced oxygen carrying capacity by increasing your breathing rate. What makes this process insidious is that anemia develops gradually as kidney function declines over months and years. You do not wake up one day suddenly anemic and immediately aware that something is wrong. It creeps up on you slowly. You adapt to feeling slightly worse. You tell yourself that you are just getting older, that you have been stressed lately, that you need more sleep or a vacation. By the time the anemia becomes severe enough to prompt medical testing, significant kidney damage may have already occurred. The diagnostic process is straightforward once someone thinks to look. A complete blood count, which is probably the most commonly performed blood test, will reveal anemia characterized by low hemoglobin and low hematocrit values. Additional testing can confirm that the anemia is not due to iron deficiency or bleeding, and is indeed related to reduced EPO production from kidney dysfunction. Once identified, kidney-related anemia can be treated with EPO injections or newer medications that stimulate your body's own EPO production, but the underlying kidney disease still needs to be addressed to prevent further decline. The fourth warning sign is nocturia, which is the medical term for needing to urinate frequently during the night. This symptom worsens progressively as kidney disease advances and is often dismissed as a normal part of aging or attributed to drinking fluids too late in the evening. Healthy kidneys have the ability to concentrate your urine during sleep. Your body produces anti-diuretic hormone, or AD, which signals your kidneys to reabsorb more water and produce less urine at night so you can sleep without interruption. Your kidneys respond by producing small volumes of highly concentrated urine during your sleeping hours. This is why your first morning urine is typically darker in color, more concentrated, and sometimes has a stronger odour compared to urine you produce during the day. When kidney function declines, this concentrating ability is progressively lost. The damaged tubules in your kidneys cannot respond properly to ADG signals and cannot reabsorb water efficiently. The result is that your kidneys continue producing dilute urine throughout the night, and your bladder fills repeatedly, waking you to urinate. This is distinct from other causes of nighttime urination like drinking large amounts of fluid before bed or having an overactive bladder. It represents a fundamental loss of your kidney's ability to regulate fluid balance according to your body's natural circadian rhythms. The pattern to pay attention to is one of progressive worsening over time. Waking once per night to urinate when you are over the age of 50 is relatively common and not necessarily concerning on its own. But if you find yourself waking 3, 4, or 5 times per night to urinate, if this pattern has developed or worsened relatively recently, if the nighttime urination is producing significant volumes of urine rather than just small amounts, these are signs that warrant medical evaluation. The 5th warning sign is puffy eyes, particularly noticeable in the morning when you first wake up. This relates to the fluid retention mechanisms we discussed earlier, but manifests in a specific location due to the unique anatomy around your eyes. The skin surrounding your eyes is among the thinnest and most elastic anywhere on your body, making it particularly susceptible to displaying fluid accumulation that might not be visible elsewhere. When you are losing protein through your kidneys and your blood albumin levels drop, fluid does not stay within your blood vessels as effectively. During sleep, when you are lying horizontal for hours, this excess fluid distributes more evenly throughout your body, rather than pooling in your lower extremities as it does during the day when you are upright. The loose, thin tissue around your eyes readily accumulates this fluid, creating puffiness or swelling that is often most prominent when you first wake up and look in the mirror. The pattern is typically symmetrical, affecting both eyes equally. If only one eye is swollen, that is more likely to represent a local problem such as an infection, injury, or allergic reaction, and should be evaluated promptly, but is less likely to indicate kidney disease. The swelling usually diminishes somewhat as the day progresses, and you spend time upright, allowing gravity to pull the fluid back downward. However, as kidney disease advances, the periorbital swelling may persist throughout the day and become accompanied by visible swelling in other areas like your hands and face. The 6th warning sign might seem completely unrelated to your kidneys at first consideration, but it is actually a direct consequence of their regulatory dysfunction, and that is muscle cramps. Your kidneys are responsible for maintaining precise electrolyte balance in your body, particularly the levels of sodium, potassium, calcium, magnesium, and phosphate. These electrolytes are absolutely critical for normal muscle contraction and nerve signaling. The electrical impulses that control your muscles depend on specific concentrations of these minerals being present both inside and outside your cells. When kidney function declines, the ability to regulate these electrolytes becomes impaired. Levels can swing too high or too low, and the delicate balance between them shifts in ways that disrupt normal physiology. Muscle cramps occur when there are rapid involuntary contractions that fail to relax properly. This happens when the electrical signals controlling muscle activity become disrupted, which electrolyte imbalances directly cause. Low calcium levels make your muscles hyperexcitable and prone to spasm. Low magnesium impairs the normal relaxation phase of muscle contraction. Either high or low potassium disrupts the normal electrical activity across nerve and muscle cell membranes. The cramps associated with kidney disease tend to be different from the ordinary cramps you might experience after vigorous exercise. They are typically more severe and more frequent. They often occur at rest rather than during activity, and they are particularly common at night when they can significantly disrupt sleep. They may be accompanied by other symptoms of electrolyte imbalance, such as generalized weakness, sensations of an irregular or racing heartbeat, or numbness and tingling in your fingers and toes. The diagnostic approach involves checking a comprehensive metabolic panel to measure your electrolyte levels along with standard kidney function tests. Treatment depends on which specific electrolytes are out of balance. For people with established kidney disease, managing electrolytes often requires careful dietary modifications, specific supplements, or in advanced cases, dialysis to artificially remove excess electrolytes or replace those that are deficient. The seventh and final warning sign is perhaps the most unexpected of all, something that seems to have nothing to do with kidney function but is actually well documented in kidney disease, and that is persistent itchy skin. The medical term for this is uremic pruritus, meaning itching caused by the buildup of uremic toxins that occurs in kidney failure. The mechanism behind this itching is complex and involves multiple contributing factors. As kidney function declines, waste products that should be filtered from your blood and excreted in urine begin accumulating in your bloodstream. Some of these waste products deposit in your skin, where they trigger inflammatory responses and create the sensation of itching. Parathyroid hormone levels typically rise in kidney disease as the kidneys fail to properly activate vitamin D and regulate calcium and phosphate metabolism. And elevated parathyroid hormone is strongly associated with itching. There is also a component related to skin hydration. Despite overall fluid retention in the body, the metabolic disturbances of kidney disease can leave the skin itself dehydrated and more prone to itching. Additionally, the metabolic abnormalities affect nerve function, potentially causing neurogenic itching, where the sensation occurs without any visible changes to the skin surface. What makes uremic pruritus particularly distressing is that it often does not respond to typical treatments for itching. Antihistamines that work well for allergic itching frequently provide little relief. Moisturizers help somewhat, but do not resolve the underlying problem. The itch can become severe, constant, and truly debilitating, affecting sleep quality and overall quality of life significantly. It tends to worsen as kidney disease progresses, and often does not fully resolve until kidney function is improved through dialysis or transplantation. The pattern to recognize is itching that is widespread rather than localized to a specific rash or area, itching that persists despite treatment with over-the-counter remedies, itching that is worse at night or significantly interferes with your ability to sleep, and itching that occurs alongside any of the other kidney symptoms we have discussed today. The common thread running through all 7 of these warning signs is that they represent different aspects of kidney dysfunction, manifesting in ways you can observe if you know what to look for. Foamy urine shows that protein is leaking through damaged filtration barriers. Ankle swelling and puffy eyes demonstrate that fluid regulation has failed. Persistent fatigue reflects anemia from reduced hormone production. Nocturia reveals the lost ability to concentrate urine during sleep. Muscle cramps signal electrolyte dysregulation, and itching indicates waste accumulation and metabolic disturbance throughout the body. None of these symptoms in isolation confirms kidney disease, and having 1 or 2 does not necessarily mean your kidneys are failing, so there is no need to panic if you recognize a single symptom. But they are signals worth paying attention to, particularly if you have risk factors such as diabetes, high blood pressure, or a family history of kidney disease. The earlier kidney disease is detected, the more opportunities exist to slow its progression, prevent serious complications, maintain quality of life, and potentially extend your life by years or decades. The tragedy is that most people ignore these warning signs until they have reached advanced kidney disease and are facing dialysis or transplant evaluation. At that point, medicine is primarily managing the disease rather than preventing it. But if you catch these signs early, investigate them properly, work with your doctor to address underlying causes and implement protective strategies, you can potentially preserve kidney function far longer than you would if you waited until symptoms became impossible to ignore. You now understand what these symptoms mean at a physiological level, and you know that your body is constantly communicating about its internal state through signals like these. The question is whether you will pay attention and act on this information before damage becomes irreversible. If you found this information valuable, consider subscribing to Helix for more content focused on understanding your body and optimizing your health for the long term.